Okay, so um, here are some just guidelines and steps when we're talking about managed care plans and applying, for qualification for certain managed care plans, like Medicaid and different insurances and things like that. Um, Again, getting organized and being prepared are your most helpful uh, tools, for doing that. Um, Applications for these types of things are known to be pretty lengthy, uh, and 30 to 50 page applications can take quite a bit of time. So really having that organization down, knowing what information is needed for the applications, having it ready, giving yourself plenty of time to do so. And in order to make sure that things are done in a timely manner, starting early is going to be beneficial because it will be helpful for this qualification to go through before working with clients to be able to, connect them through their insurance and other options like Medicare before getting started. And because these applications are lengthy, again, starting early is key. There is the CAQH, the Council for Affordable Quality Health Service, and you can go on there and enter all of your information into one application as opposed to multiple applications that are 30 to 50 page long, 30 to 50 pages long. If we're doing several 50-page applications, we could be looking at thousands of pages of applications alone just to connect us to insurances. And so using that service might be helpful for you. When we're working on these applications, making copies of everything, and this doesn't need necessarily just have to apply for getting on managed care panels, but it also could be helpful for other steps in the process of building or expanding your practice. Is having copies of everything that you're doing, any application that you put forth, any rough drafts or final drafts of documentation that you have, making sure copies are made are going to be helpful because if we ever lose something or need to keep track of something or check in on something, you have that copy made. So with those copies, then we also need to have organization so we know where we're keeping everything. Document when your applications are filed and make sure you have those paper trails of things that are filed and received, so you know it was there, it was sent in, it was submitted, and you know how to kind of check in on that because you have proof of that submission. And then follow up. We spent a lot of time applying for this to be on a managed care panel, and then we might not hear anything. And so we do want to keep those paper trails so we can follow up and figure out what's going on with those applications. In order to help us with some of this as well, starting with the current contacts we know, who may have information about different managed care panels, or maybe even work in that area of managed care, know of different insurance companies, know about Medicare, Medicaid, whatever it is. They might be our first go-to when we're looking at these applications. They might have suggestions on how to do things in a quick manner or how to get things submitted a little faster than it might typically take. So again, these are just some tips. Whether or not we decide we are going to be working with insurance companies or accepting Medicare, things like that, it's still helpful to think of ways that can expedite that process and make it a little bit more simple for us if we just do decide to do that in our practice. Um, Kind of going back off of the last point in the last slide, networking and partnering are very crucial um, things to do. So in order to really build and expand, we're going to start first with who we know and figure out how to grow that network and support system, so that our own practice is accessible to others, is known to others, and will be used by others. So again, whether we're private or whether we're a nonprofit, using the resources that we're aware of could be kind of possibly what makes or breaks the success of a practice. So in order to start that networking and partnership process and those steps, starting to assess and identify current resources and partnerships that already exist uh, will kind of lay the groundwork. Who are the people I already know? What services do they provide? Where are they? How do they relate to your practice? And how are they going to be able to help you in getting towards your goals? And then in addition, how can you help them? Because ideally these networks and these partnerships will be reciprocal, and while you might be utilizing them as a resource and connecting with them and allowing them to kind of help you, it's also helpful for you to determine how you can be of assistance to that partner, and help that be more of a reciprocal relationship. So yeah, first starting by identifying those current resources and partnerships. After you identify those networks are able to then refer you to other networks, really determining who are the people that you would want to refer to your clients, and who will refer clients to you, and then moving outwards. So starting with your current list, and then working with that list to get referrals, to meet new people, and to create that list of resources that will help you and help your clients. And then it's not enough to just build that network, but we need to maintain that network. So establish a routine to maintain and manage those networks so that those partnerships are not lost. However you decided that reciprocal relationship can be, making sure you're continuing to provide that assistance and that energy, to your partner, to those networks, and then continuing to check in and assess how that partner is being helpful for you. So again, more just tips to consider as we've been learning so much information. Just kind of summarizing some of those helpful tips for us. Okay, and this again, just a list of some of those resources and networks and some of those partnerships we might want to have. Being aware of nonprofit counseling and the counseling agencies in the area, in our community. What do they offer? Who do they serve? What are forms of payment that they take if it's a service that you can't provide yourself? It might be helpful to know where to send clients to, where to refer them to. Psychiatrists, unless your practice has a psychiatrist of its own, it's possible that referring to psychiatrists might be helpful if there are clients that manage medication and the like, things like that. Legal representatives, I know as a nonprofit organization, we are partnered and rely heavily on a community legal aid organization that provides free legal services to our clients, and we're constantly referring to them, and in return they're constantly referring back over to our agency for the services that clients might be asking of from them. Medical professionals, so community doctors, nurse practitioners, school professionals, who are the people in the schools that might be working with your clients, and in terms of administrators, educators, school counselors, how can everybody kind of help each other out. Religious affiliates in the community, resources that provide help with housing and finances and stability in those areas. Okay, so whether or not we're talking private practice or nonprofit, and again, this might be more more applicable to a private practice, but what are our fees, and how do we set a rate? If it's nonprofit, a lot of our fees are set for us, or we might be contracted by certain um, community organizations that contract us, set what our budget is, give us a specific amount, and set the fees for our services. But if we are private, we need to figure out what our own fees are going to be. And so this is kind of, again, just more tools for helping us figure out what a fair rate might be. As a professional, we might be trying to decide if we're going to have a fixed rate versus a sliding scale. And these little steps are very helpful when kind of spelled out this way to determine, can I afford to do a sliding scale, or does it need to be a fixed rate? So first we're going to want to identify what the typical fees for similar services in our community might be. What are other agencies offering, or organizations offering, and how much do they charge for a service that's similar to ours? Then you're going to want to go ahead and assess for all of the costs that are related to running a practice in a 12-month period, so over the year. We then need to add what our annual income is that we wish to earn, and that would be just that kind of extra earned income on top of what it might take to build or run a practice. And then we're going to add those all together. So what does it take to run the practice? What else do I want to make in addition to that? We add that together and we divide it by 12, and then you're going to get what that minimum monthly income needs to be. If you've already been working in a practice and you have an idea of how many clients have been seen on average each month for the past 12 months, or if you haven't but can realistically estimate how many clients you might be able to work with over or each month, and then do that over the span of 12 months, we want to get how many clients total can be seen over the 12 months, and then divide that by 12 to see the average number of clients that have been seen or can be seen in a month. Then we divide our minimum monthly income, and we divide that by the average of the clients we have per month, and that number you get is the minimum number that you would need to be able to run your business smoothly without maybe feeling stressed out or on edge that maybe you won't be meeting your numbers. So that has to be your minimum. You divide your income and you divide it by the average number of clients you'll see in a month. If you're deciding to do a sliding scale, you can use that minimum to create a breakdown of the different income levels and the different fees you might provide. So that minimum is the minimum rate, and that would be maybe the lowest level of income, and then you would increase that accordingly and as fair as possible. So those are just some practical and kind of simple steps to setting a practice. It can be easy to just say, pick a number and say, hey, this is what I want to make, so I'm going to go ahead and charge my clients this. But this seems to be, again, a really practical way to break all of that down to figure out what's the minimum amount I need and what's the maximum amount I feel comfortable with. All right, so then we come to paperwork and forms. Any working counselor is going to come across different forms that need to be used and implemented with clients. These are just some of the important forms that should be utilized while maintaining clients. And I also am going to show some examples of forms that I have used, or similar examples that could be used. So of course, there's a new client registration form, getting the initial information at the beginning, who they are, what their contact information is, what they're there for, things like that. Your typical forms for payment, consent to collect payment, and then providing receipts. Then we have our general intake and assessment forms that that really encourage client information and informing client of their rights under HIPAA and their rights of confidentiality, things like that. And then also providing a contract, for services, making sure that a policy for no-shows, cancellations, and payments is outlined very specifically. So I will kind of show examples of a consent to treatment form, a notice of privacy practices form, and then a release of information form. There's all kinds of different ways that this information can be collected, but I wanted to kind of show some examples of that. Client intake and assessment forms can also look very different depending on the client you're working with, what information you're wanting to collect, and the type of assessment being done. So I know an assessment that I do with the clients that I have worked with in domestic violence is going to focus more on domestic violence histories, while other mental health services might focus more on a biopsychosocial type of collection of data, mental health history, medical history, family history, things like that. And so those intake and assessment forms could look very different, could be very short, could be very long, depending on who you are working with. Creating that contract with the client for whatever services you're providing, really spelling out this is how many times you can be late, or you can cancel without there being a consequence. Different counseling programs at my agency have different policies. If it's a private practice, you get to kind of decide that on your own. What is the consequence for late cancellations? A lot of times, if people cancel with less than 24 hours notice, there is a fee that needs to be paid, and that needs to be decided right away, and that information needs to be relayed to client, and then policy for collecting payments, and the whatever that rate might be. One of the other forms that I think is really helpful in getting to client or giving to the client is a list of emergency contact numbers, who can be reached and in what way and for what reasons. So a lot of times, if the typical business number is unreachable business hours, it's not during business hours, and client needs help, it's helpful to have a list that you already provided at the beginning, and client signs understanding that this is who they can call for different reasons. Maybe the practice or organization has an emergency number. Maybe it doesn't. If not, providing emergency numbers, the number for the child abuse hotline, a number for a suicide hotline, things like that, could be very helpful and kind of make a difference in saving somebody from getting deeper into possible safety issues. So really helping out and creating maybe what a safety plan would look like. If this happens, I can call this person, or I can call these numbers or resources. So I've found that can be beneficial, especially in certain programs. Again, working with people who've experienced trauma or domestic violence, or other things like that, that could be relevant for that. So I just kind of wanted to show you some examples. This is an example of a consent for treatment form that I've seen and I've worked with, clearly listing the agency or practice name, fax and phone number on it, having the client or the parent who is consenting for treatment sign, fill out their information, clearly stating that they give their consent to be provided with services by the specific counselor of whatever organization they belong to, and then checking off if it's for themselves or their children. So maybe they're filling one out for the whole family, maybe it's just for themselves, or maybe it's for their children. It lists the services that are going to be provided, if it's counseling visits, case management, things like that, and then also lists limits of confidentiality right on the consent form. Also taking in consideration that there's different levels of education and different credentials that different therapists might have, spelling out who it is that's going to be providing those services, what training that counselor has or that therapist has, and whether or not they're being supervised. That's important to inform the client right away, and that kind of defines what informed consent is. I have informed my client of all the service they're being provided by which professional, and these are the reasons why confidentiality might be broken. After explaining what confidentiality is in the first place. So client signs and dates, counselor signs and dates. And I've also seen forms where if there is a supervisor responsible for the supervision of clinical contact, then the supervisor will also sign just to ensure that they are overseeing this client and have discussed, how to deliver some of these to that professional. This is an example of a consent to release information form, or a ROI, that has been used, or and then I've worked with as well. Again, stating agency or practice name, the address and phone number is on there. It's helpful to always indicate where these forms are coming from and who they're relevant for. Giving clear guidelines for where information goes. The top portion is to the representative of whatever agency you're releasing information for. So if you're talking to a social worker, you put their name and their agency there, the address of the place that they work at, their contact information, their fax number. Those are most likely the contact numbers that you'll be using to release this information. And then from who. So the counselor that is releasing the information, where they're releasing information from, so their professional address, phone number, their fax. And regarding who, the client and the client's date of birth, to just be a little more identifiable for who you're actually releasing information about. There's the option to obtain information, release information, or exchange information. Check boxes of different kinds of information that could be released and exchanged. And there's also this option for other, if you need to make it more, individualized for the client you're working with. There's options for individualizing what the exchange of information, what the purpose is, and if there's any restrictions. So some people want a one-time release only. There might be other restrictions that the client wants to make. And then the date that this release form is no longer valid. And it states on there that it stops taking effect after a certain amount of time, or 30 days after discharge, or a specific date if client opts for a specific date. Again, gets client signature and staff signature or counselor signature. And then one other thing I just kind of wanted to show, and I can send some of these if anyone is interested in seeing these more or further, is the notice of privacy practices. Often several pages, very helpful for identifying what some of the rules under HIPAA are, what some of the rights are, and showing how your organization or practice is HIPAA compliant, identifying ways to obtain documentation and records, how PHI is going to be used, things like that. And so these are all things that should be on a notice of privacy practices. Some are shorter, some are longer, depending on how thorough a professional determines to be. This document is then given to the client. They get to read it, determine if they have any questions. Typically on the document as well, there is someone to contact if there's any concerns about privacy, known as a privacy officer. I know at my agency we have an identified privacy officer with contact information on there. And then after they are able to read through that, you as a professional should also be familiar in case they do have questions and you need to discuss those questions with them. Then typically an acknowledgement of receiving those. I've received the notice of privacy practices. I understand these things, and if I have any questions, I know who I can contact. And then they would go ahead and sign and date that they received it, and then there's a witness that signs and dates. So that's the provider or counselor's signature that goes there. If for some reason there isn't, this notice of privacy practices given or provided to the client, then it can also be indicated that or why it hasn't been provided. Okay, so I think I might be running out of time soon, so I'll go through these pretty quickly. Again, I wanted to share some tips about maintaining confidentiality and ethical practices. So, providing disclosure statements and scope of practice, providing that informed consent and consent to release, making sure those are always obtained, making sure the privacy statements and HIPAA and describing HIPAA regulations and rights are always provided. Making sure that you're informing clients about the billing and insurance companies about how information is collected and provided, and then taking into mind how you as a professional do record keeping in your agency, or in how the practice or organization maintains record keeping. Is it electronic versus paper? If it's electronic, are all of the confidentiality guidelines taken into consideration? Is it HIPAA compliant? Is it secure? And those are things to take into consideration. And there's pros and cons to electronic versus paper that I won't go super into detail with, because I think I'm running out of time. How do you store and manage records? Are they, as they should be kept locked in a safe place? How do you destroy those records? And are you keeping up with the guidelines of how long you can keep those records and how long you should keep those records? Because I know in our state now, I don't know if it's different in other states, but we do keep records until children are 26 years old. So those are things to consider. Where can you keep them? Where is there room to keep them? Things like that. Other just small tips for maintaining confidentiality and ethical practices. In your practice, maintain membership with a professional organization. So if in doubt, consult. If you're part of a national organization, that might be ACA, the American Counseling Association. In California, it's CAMP for the MFT, and it's CalPCC for the LPCC. Those are the professional organizations for our state. Establish a network for ethical support. So in your networking that you've done, who in there can help consult, who might know about legal questions, who might know about ethical questions, identify those resources. Make sure you're keeping up with changes to ethics and laws, and they're changing all the time. And if you're part of those organizations, you'll get those updates wisely, or you'll get those updates, frequently. I was going to make the next point. Use your technology wisely. So if you are doing any electronic sharing of files or electronic data keeping, make sure there's data encryption. Make sure you're using secured websites, secured emails, and do your best not to send PHI electronically. There's an error there. PHI electronically as much as possible. Other tips for preserving privacy is making sure file rooms are locked. File cabinets can also lock if you need extra space for storage. The idea of using sound machines to minimize overhearing sensitive information in those counseling rooms that could have thin walls. Be mindful of the location of counseling rooms, and in the organization, our best practice is to ensure that our counseling rooms are separated from our workspace, so and the public, so that wherever counseling is happening, there's less chance for what's being heard to be shared with other people. And then never use personal devices to manage PHI. I'm sorry, that kept converting, because that just minimizes the opportunity for information to be leaked or shared inappropriately. And then lastly, but not least, little tips again for just staying in business, managing that practice again, whether nonprofit, whether private, is continuing to plan, continuing to set and reset your goals, and measuring progress along the way. Setting boundaries is going to be really helpful, because it'd be really easy to kind of over achieve or to over extend yourself. So making sure your own personal needs are met as well as your professional needs. Make sure that the needs of your clients are being met. So when you originally set out to serve the certain population and a certain group of people, making sure that you're continuing to keep that in mind, because it can be really easy to lose sight of that. And in order to make sure that you're not losing sight, plan self-care, know what makes you feel better, know how to release certain emotions so you can preserve that passion that you had at the beginning to help others, and to make sure you're avoiding that burnout so you don't lose, your energy and your fuel. Keep checking in with your values and your morals, because it can be really easy to lose sight of that, especially when you're on the fiscal end of things, and trying to do things that also kind of keep your practice afloat. It could be really easy to lose sense of your values and morals, and of course find a way to make your work fun. The more fun our work is, the more it doesn't feel like work. So that's probably one of the most important tips I can share with. Make sure your work is fun, and it's never work. So that's what I have for you. Here are some of my references. Any questions, please let me know, and I will be gladly answer them. Thank you, everyone, for listening. Have a good day.